Another session of our Vitality Chats. Today, I have the great pleasure of interviewing Dr. Jake Holman, one of our lead instructors, and he has just started his new practice in Colorado, and we're really excited to hear from him and hear about his life experiences.
Yeah, and I know, Dr. Holman, you have a very inspiring story about kind of the beginning of your chiropractic journey. So, would you like to share that today with us?
I would absolutely love to. It is the very reason that I am sitting here today, and what led me down the path of studying with you guys. So yeah, I'll jump right into to deep waters here. Uh, so I'm Dr. Jake Holman. Obviously, I've been in practice for about 13 years, and when I went to chiropractic school, I did not intend on working with children or babies, pregnancy. Family care was not really on my radar. I wanted to work with football players because I had been a football player. I was 19 and young. I was doing some IT work. Those are just details. But I did not like that work at all. It was just a way to pay bills, but I loved exercise and fitness. I was a big gym rat at the time, right? 19, raging hormones, and nothing better to do with my time. So I found solace in working out, and I thought I was going to be an accomplished football player. So I was on a semi-professional football team, and I was a personal trainer at night after hours. And I got really hurt at a practice one time, and I'd never really experienced anything like that in my younger years. And the medical system, I took the medical path. It's what everybody did then, and they gave me muscle relaxers and painkillers, and nothing changed. Nothing happened for 2.5 weeks, and that was the longest I had not worked out in probably half a decade. So that really bothered me, and I wanted to get back on the field. I wanted to get playing again. And so one day at work, a colleague of mine, probably sick and tired of hearing me, bitch and moan every time I got up and out of my chair, she says, "Why don't you go see the chiropractor across the street?" And it wasn't necessarily a new concept to me. I'd been to the chiropractor. My wife, in a bless her heart, she'd been getting adjusted her entire life because she was, a three-sport athlete, and I had gone with her to the chiropractor, sat in the lobby, and I wish I could tell you I stared at my phone while I was there, but that was way before phones. So I just sat there, acted too good. But nonetheless, I had never really considered chiropractic. But when she said that, I thought, you know what? I've got it. I've got to do something. Nothing is changing. And so I went, and my life sort of changed. That I had the big aha, moment where the world just looked different to me after I got adjusted. And not only did I feel better, but all of a sudden I had this new inspiration. Because underneath all of that, I had always wanted to help people. The IT work that I was doing at the time didn't seem all that important in the grand spectrum of the world. And I just wanted to do something that mattered uh, to me personally, to the world at large, and something to help people. And I didn't want to be tied to a cubicle underneath fluorescent lights all day. I definitely knew that. And so when this came up, I was inspired. And there's a lot of life that happened in between, but fast forward a couple of years, and I'm in chiropractic school, and my wife and I decided that it was a good idea to start our family while we were in school. And so
That same idea too. Yeah.
yeah, it's like, you know what, things aren't hard enough.
It's a brilliant idea.
Yeah. And so, that is really what planted the seed for us because, we did what every young couple did. We found an OB, and we followed their instructions. And as we would learn, we did not know anything about what we were doing. And we sort of entrusted that to the professionals that we hired at that time.
Mhm.
And that left us in a very unempowered, uneducated, uninformed place. And as we would come to learn, you can't control everything, but we've learned that you can control some things. And we were, unknowingly, and there's accountability on us also, but we were sort of led down this intervention-based path that led to a significant birth experience for my wife and my son. And he was a forceps delivery, just to kind of cut the story short. It was an incredibly long intervention-based labor and delivery that ended with forceps. And my son was incredibly injured during that. He didn't eat for about 2 or 3 days afterwards because his face was so bruised and mashed from the forceps. And then I remember my wife saying right afterwards that she was so tired from the fight of delivery that she couldn't even hold him right after he was born because she was so tired. She was afraid she would drop him. Right. And
Oh,
so obviously, and these things take on greater context later in life as you learn more
of course.
about the process, But luckily during that time period, I had been listening just enough during pediatrics class at school to hear somebody say that they may have been working with kids and significant birth experiences. So my son, the result of that obviously was a significant torticollis plagiocephaly that he had developed right away. And we didn't know what to do. And we were immediately referred to an OT and PT who, gave us this really glim sort of prognosis, and they wanted to put him in a helmet. And that terrified me. I didn't really know a whole lot about that stuff at that point. And quite honestly, my main motivation at that juncture was I just didn't want him in a helmet because I didn't want people to think something was wrong with him,
Of course. Of course.
And it's a weird place to to go back to emotionally, but
You could have just told
that's
your training to be a football player.
right. So then we go to this chiropractor who taught pediatrics at Logan, and I just said like, hey, this is what happened. We need help. And I watched her adjust him. She was doing something in his mouth with his head, and
Mm,
it only took a couple of weeks, and we went back for an OT PT follow-up, and they said, I don't know what you did, I don't know what changed, but he's fine. He doesn't need any of that.
Well,
You're good to go. And those moments, they took my breath away because, I loved football. I really wanted to be the next great chiropractor for the Denver Broncos. I think they could have used me at the time, but
probably.
um, you know, that experience, it didn't just change the trajectory of my son's life, it changed the trajectory of our entire family. It changed everything. And then I thought, what better way to relate to people than the experience that I just had? I would love to
Absolutely.
do what these people did for us. And then I even thought to myself, like, I will never have to sell anything moving forward because I get to tell my story. I'm not selling a story.
it's an
You know what I
internal
Yes,
process,
it-
and that's very different when people feel it. It's not a sales process. It's like, here's my experience. Can you relate to it? Let's move forward
But
from here.
but it's also stems from your own personal experience with your own injury. So let's go a little bit about, that experience, like where the medical profession has nothing to offer you but drugs. And we personally know many young athletes that become addicted to those drugs because it's the only solution. So you had that experience of the power of chiropractic
Yep.
and then now a much more deeper personal experience when it's your own son and your wife that's injured. So a very, very powerful thing that has transformed your life and moved you forward to be the chiropractor that you are now. But how inspiring it is that's I know, Dr. Marty also has a personal experience with a sport injury where the medical profession just wrote him off at the age of 17. That just wasn't, oh, we don't have anything. Well, you don't have anything because you're not trained as a chiropractor. And thank
Right.
goodness we have that. And thank goodness we know the person that took care of your child when you were in school and the amazing work that she does. And her work has transformed many, many students' lives. So we're grateful for Dr. Mary. I'd like to shout out her name.
Absolutely.
So now,
So, but you know what I also like, and I really like about your story is your ability to take in your experience, your life experience, and then transform into something that's usable. Like a lot of people take in life experience and they just move on, or it becomes a hurt or a wound or something. But using life experiences for something to stand and
to
grow on
empower you.
is
Yes.
a unique skill. It's really a unique skill set. It's like shifting. Like, I wanted to be the first Jewish goalie for the New York Rangers. That was what I wanted to do. That was gonna be my thing.
Yeah.
And right. So that didn't happen.
Thank goodness.
Well, I would have been a good Jewish goalie.
I don't know.
No, but seriously, but being able to make those shifts, and like when someone says to you, this is all you have, and you're like, wait, that's a really narrow vision. There's got to be a bigger vision. Like Nancy said, I had the same experience. You're 17, you should give up playing sports. I'm like, okay, that's not my life. So being able to do that and to move on, the same thing with your child, even a state of that kind of trauma, to be able to go, wow, we need help. Where we're at, the road we're traveling on is not it. we need to find a different road. And I think that's amazing. And that's what I actually like about you when you teach and you do things, is that your ability to adapt to those situations and make them grow instead of shrinking in them.
And I want to shout out to all the parents who might be listening to this. And this is one of the things that we are very, very committed to, is being an informed parent. So there's no judgment of the road that you're on. It's the road that you're on. But when something else comes into your life that shifts it and changes it, and let you know that there are other resources out there that to help you on this journey. And Dr. Jacob is definitely expressing that now. So thank you so much for that really inspiring personal story. And is there anything that you'd like to, say to the other chiropractors out there that are on this journey? Like, not everyone is meant to be a pediatric chiropractor, but certainly, there's a wide range of ways that we can help. And all of it comes from that inner drive of wanting to make a difference, of wanting to serve, of wanting to help people. So I've heard that also, you say that as well. Is there anything that you could express to the chiropractors or to the public listening to this about, how you can inspire them?
And what help allows you to, move through those
Yes.
processes.
Absolutely. And I think that boils back to, one of the questions that we sort of went over beforehand is, what advice would you offer, right, with the journey and the experiences?
Right.
And I think that a lot of it boils down to, well, first, you want to decide who your ideal avatar is, right? Who is it that you want to spend most of your time with throughout the day? And if it's generally everybody, that's fine. Back to the point, like you said, not everybody's cut out to be a pediatric chiropractor, but as I've grown and evolved through this work, it's not necessarily just about pediatrics. It's about the nervous system, right? And one of the testaments, or one of the strengths of my story, what I love is that I've had a number of different experiences with chiropractic with a different utilization, right? And that kind of goes back to whatever your intentions are, it shifts your objectives, which is going to shift your outcomes. And, I used it for a sports injury, and I got a series of adjustments over a period of time to get me out of pain, and that was great. And then as I would evolve and learn about chiropractic, is that it's great to be used like that, but then there's a grander scheme, right? There's a more
for sure.
It's a bigger picture.
There's a bigger picture. There's there's greater potential, right, in utilization of chiropractic in certain ways. And so that said, if that's where you're at, I can't emphasize enough to continue to up your game. And I think that starts with realizing where you're at right now and recognizing where you're lacking in, right? Recognize your strengths, that's positive too, but recognize where you're at. And if you have a patient who you're not able to serve confidently in some form or fashion, that's an opportunity for you to learn something different, learn something more. And I'm not talking about going out and buying SoftWave or
Right.
PRP injections or anything like that, but there's a deeper layer of interacting with the nervous system, as we know, that can help not just newborns, but 80-year-olds, right? I tell people I've gathered this. I've accumulated these cases that are precarious and they have particular circumstances to them. And I think it's because a pediatric trained chiropractor like we are makes for a better, well-rounded clinician.
Of course.
Yeah, because you're looking at the nervous system.
That's exactly right. That's exactly right. So that's what I say. It has evolved from being pediatric focused neuro, focused care to just nervous system focused care in general for the family.
That's true. That's great.
Yeah, I think that's an important fact. When you're dealing with, also when I started practicing too, I was really into biomechanics, changing structure, increasing, bringing normal cervical curves and balancing, reducing scoliosis. And it was great. And it was really cool to see the empirical evidence of it changing. But then when you get, what happens when you get a patient or a little baby that the curves haven't developed yet? Where do you go with that? Or someone who's not sick? Like, why do I get chiropractic care? And you're right. It's all about the nervous system. It's all about that. And the things that change, even those structural changes, only occurred because I was able to positively affect the nervous system and the way it communicates with the rest of the body. So you're right. Pediatric chiropractic helps you focus on that, but it really helps to expand the picture, and it really helps to explain why, we talk about human potential. If you're going to create human potential, you're going to create that human potential in the first couple of years of life. That's when you're really laying that foundation. I think it's really important. Even if, like you said, if you don't want to adjust kids, I'm sure it happens to you. It happens to me. I have friends and people who are chiropractors who don't feel comfortable adjusting kids under 10 years old. So they'll send them to me, to adjust them. But but the important part of that is they understand the importance of it. They just don't feel like they have the skill set or want to go out and get it. you know?
Right. Right.
And that's okay. That's alludes back to the fact you said, know what you know and know what you don't know.
Yeah,
Absolutely.
that the ability to self-evaluate, and then life will throw you things. I mean, certainly life threw you something with your firstborn that challenged you. But at the same token, you could have walked away and referred that baby to and somebody else, but instead you embraced the journey and it, more than embraced it, like really jumped in, head first. And I think that's an amazing trait of yours. So your story is so memorable. And inspiring. And I do think that's a really important piece of what you said, is to know yourself. Looking at your journey going forward, I mean, where do you see yourself going, Dr. Jake?
Ooh, right now I've got my blinders on, and right
Good.
now I'm
Yeah.
focused on
Yep.
growing this practice that we just took over. Again, I have this amazing opportunity to step into a place where chiropractic is amazing. I tell people this: you don't even have to be that great at it to
Mhm.
help a bunch of people. That's
That's
the
true. That's
power
Yeah.
of
true.
what we do. But what's nice is having a little bit of an advanced level of training and stepping in and watching people go like, wow, there's another layer to this. There's a whole
Mhm.
other
Yep.
level of this that we've not been exposed to. So I'm really just enjoying that right now. Our practice is named Wild Roots because we are wild, and we have wild roots. We've planted them all over, but we're trying to put them in the ground here in our birthplace, so in
That's
the
awesome.
short term, I'm just going to grow this practice because I would love to get to a place where, I've got a couple of highly skilled associates that are in here helping me create impact with people.
Sure.
Uh, and I do love adjusting. Like, I could never step away from that
I love
fully,
that. I
Mhm.
love
but
that.
I also I love sharing this work. You know what I mean? I love teaching, and
Mhm.
studying with you guys and studying this work has just provided a level of clarity and certainty in the office. I don't really get nervous when I meet new
Yep.
Mhm.
Yeah, I know
people.
that feeling. Yeah.
You have these incredibly neurodiverse presentations that just tend to find you, and it's like, you know what? This is a big scary monster, but have the tools to deal with it. You know what I mean? I have the language to speak and the lens to look through to do
That's
something
awesome.
positive for this human, for this nervous system in front of me. So I just want to facilitate the ability to continue to do that, while growing a practice and, you know,
Raising your family. Yeah.
I think it's important point you made is too, to be able to have a lens to look through, to know, like, when someone comes in that's really looks challenging, is to know, all right, I'm going to look at their nervous system, see what the baseline is and impact that nervous system, and not think about what that outcome is, because you don't know what that outcome is for that person. Like you said, you had a son who had very traumatic birth, and within several weeks, his flagellopathy, his torticollis, all that stuff was resolving on the PT. And what I find interesting is that was under their parameters. Now, I am sure that Mary and you continued care after that point, because you had other parameters based on that. They were like, oh, his head looks better and he could turn his neck. And the more deeper you get into understanding the nervous system, the more baseline parameters you have and the more impact you can make into someone's nervous system. What's what I like about being able to continue to study, and that's kind of one of the reasons I'm still practicing after all these years, is not because I just love it, which I do like it. I feel like you. I don't know if I could stop adjusting, but it's also because it constantly pushes you. It constantly keeps me moving, keeps me fresh. It's like a comedian who retires from life and tries to sell the same jokes he did 20 years ago. Doesn't work.
And
right.
and haven't been in practice as long as we have, over 4 decades. I think the thing that I find interesting is we give you a map.
Mhm.
It's like so when someone walks in, it's like, yeah, I don't care what the presentation is. Do we have a way in?
That's right.
That's how I see it. It's like starting on a journey and having a map. And yeah, you can add all kinds of guideposts as you go and build a much bigger, arena. But being able to have a way in and just a
Mhm.
direction, I think that's what we like to offer people. And certainly I love working with you because you like doing that as well. So
Yeah.
so it's nice. It just
The
brings
goal is to get
certainty.
us, absolutely. The goal, I think, is to get us all speaking some level of the same language, right?
Exactly.
Mhm.
We've
Exactly.
talked about that because, and I don't care if you adjusted diversified, if you're
Right.
gonna ring dinger it, I actually prefer you.
Ring a dinger. Let's keep that
Yeah,
one
yeah,
down.
yeah, yeah. Or you're blowing on it and wishing it unsubluxated,
Yeah.
whatever.
Yeah.
But if we
Right.
speak the same language of indicators, right,
Mhm.
then we can have more cohesive, more constructive conversations. We see it all the time where it's like, hey, I've got this case.
Right.
What do you suggest I do? It's like, well, I don't know.
Mhm.
What are you seeing? What do
Right. Right.
you find?
Exactly.
You know what I
Right.
mean? Yeah.
Yeah, so one of the first things I ask a lot when I get, because I get a lot of people ask me, can you, and what often happens is when they see our stuff, maybe they're taking a class, and then within 2 to 3 classes, they're already going, do you mind if I ask you about my kid? And then they start to give it, and I'm like, well, my first question is, yeah, you said you did this, but how much like cranial adjusting you have? How much, work you do? What do you base your things on? I've done, if someone says, well, I've adjusted their spine and their cranium, I'm like, well, that doesn't mean anything to me.
Right.
Right. So it's like, where do you go with this? And we find that a lot, that people come into the classes because they're looking for something for their personal family. And that's a great way to do it. But understand, again, back to being able to get the tools and be able to get the tools and be able to have a language to speak. So when you ask me a question about, what do I do with my kid? Well, what did you find? It's
Right.
perfect. Yeah, what did you find?
Well, I think I just feel like it's just it goes right back to our chiropractic philosophy. It's an inside job, and when you have your own internal experience that drives you, it's just you can sustain so much more. And that's just true. It's like, as I don't care how they get to us, is if you get to us, it's your journey. If you can really hook into someone, and that's true of adjusting or teaching, it's the same. It's like, did I reach you that it became an internal experience so that you can then continue motivating yourself to continue the journey? Because oftentimes it is challenging. But that said, kind of thinking about some of your favorite things and your favorite techniques, is there something you could share with someone, like, because you obviously have a wide breadth of techniques, but what's your favorite? What's your go-to?
So I thought long and hard about this, you guys,
Really?
and I did, because you
Right?
start thinking like, do I have one favorite? And you're like, well, I like this one because it does this, and then it's all of a sudden you're like, well, that's not just one, that's like 2 or 3. So I'm gonna say I have 2 groupings. It's 3
Yep.
techniques, but 2 groupings of them.
Mhm.
So the first one that came to mind was the cruciate suture release.
Mm.
I love cruciate suture release because in one of my previous existences, I took care of a lot of kiddos who had rare disorders, right? Whether they were genetic or traumatic and induced, whatever. And a lot of times those CP-like presentations,
Yep.
those kiddos don't deal well with respiratory stuff, right? It's the respiratory things that get them, and their lungs are really like their weak
Mm.
spot because they can't clear them. And so I've just had some really amazing experiences with that technique in those kiddos. Because if you can provide one night of fairly decent respiratory function for a child like that,
For
that
sure.
means the absolute world to those parents. You know what I mean?
Mm.
And I would say the next grouping, we'll call it one technique maybe. I'm a Logan guy, so I love the AI sacrum adjustment, but I also love how that correlates with the compressed occiput presentation. And in my experience with this work, that particular adjustment seems to be one that like people just don't see. It's just not the sexy upper cervical adjustment that everybody wants to make right away.
Right.
And so I've made some big splashes with lots of cases, walking into a room and just going, oh yeah, look, there's a inferior occiput right there. You come back the next day, they're like, what did you do? My son had a huge bowel movement, or they
Right, he's
got
sleeping better. He's not restless. That's one of my favorites. That the SOR inferior occiput stuff.
Anterior atlas.
I like anterior. Yes,
Anterior atlas.
I'm in.
Well, see, it's like
Like-
so you're doing the same thing. How do you boil it down to one
Well,
adjustment?
my
It's like,
anterior atlas
it's
is from my
like-
it's from my years of Sherman, my toggle, the toggle monster. So I see an atlas and it's got to go.
So yeah, those.
Cool.
So that's 2. Was there a third? Because you mentioned.
I did AI sacrum and compressed occiput together.
Yeah,
Okay,
yeah.
gotcha.
That's a good combo though.
Yeah.
Yeah, absolutely.
So, and thinking about, kind of one more message that you might want. I mean, you've shared so much, and is there anything else that you want to share for those
Before we sign
Yeah,
off,
before we
anything,
sign off.
any pearl of wisdom?
I think that just being real with yourself. So back to my personal story, and one of the reasons why I take it so serious is that, if I had come across a practitioner when my son was in need, if we had found a chiropractor who was less proficient, less passionate in the work, maybe he would not have had the same results that he
Right.
had.
Mm-hmm.
He would have, but we can't say that at this juncture.
Don't know.
No,
Right.
you don't know.
The way that I internalize that is that there was a standard set than about what was expected to give to patients, right? I know what I got. I got great, excellent care, right? And so I could not give anything less than that. And so I think that you should set your bar higher, right? Whoever's listening to this, set your bar high, because you're dealing with people, right? You're dealing with parents and their kids. My kids are the most important thing to me on this entire planet. And when somebody hands you their child, it's not just their child, it's their hopes and their dreams and their future
Everything. Yep.
expectations, right? It's their time, it's their money. It's a big freaking deal to do that. And to have a parent look you in the eyes and say, "Can you help me?" If you can't look them back in the eyes and say it with certainty without your heart, fluttering,
Right.
you're probably lacking in something. And it's okay, swallow that pride
Right.
and up level. You know what I mean? And be honest with people about it. Like, hey, I'm not an expert right now, but guess what? Tomorrow I'm going to be for you. Because
Yeah, that's really beautiful. And I couldn't agree with you more. And holding yourself to that internal standard is really what all of life is about. So thank you so much for sharing your story, your personal story. The people in Colorado are so blessed to have you there as a chiropractor. Yes, and
we're lucky to have you as an instructor
Yeah.
too. We really appreciate what you do.
Yes,
thank you guys.
yes. So thank you, Dr. Jake, and we will be seeing you.
And we'll put your contact information up for people to contact you, because they can refer anybody within the Colorado area to Dr. Jake Holman.
Yes.
All right. Have
Thank
a
you.
great day, everybody. Take care, and we'll see you down the road. Bye-bye.